Good afternoon, everybody. My name is Dr. Vijay and I'm a medical oncologist at Aster CMA Hospital in Bengaluru. We are here to talk about coronavirus and what a patient with cancer needs to know. The coronavirus is a group of viruses. The first outbreak of a coronavirus was a SARS outbreak in 2002 in China. What happened in December 2019 was a second coronavirus outbreak called the COVID-19 that happened in China and has now become an epidemic, or in fact a pandemic across the world, including India, where we have now over 100 patients suffering from it. Basically, coronavirus presents as someone who has fever, cough, body ache, and tiredness. They can also have shortness of breath if the coronavirus becomes severe, which is more commonly seen in the elderly population or people with other comorbidities such as diabetes, hypertension, and cancer. Basically, you get coronavirus through droplet infection. So it is not aerosolized, so you can't get it from the air. But anyone who coughs on you, you can get it through the droplet infection if those droplets touch any of your mucous membranes, such as your mouth, nose, or eyes. Or the coronavirus can survive for a significant amount of time on surfaces, and if someone touches a surface which has previously been exposed to coronavirus, using those hands, and if they are now put into the mouth, eyes, or nose, they can be transmitted that way. Hence, it is very, very important that we understand the modes of transmission to eliminate the process of transmission from people to people. So essentially, if someone is suffering from cancer, there are two ways to look at it. One is if they have cancer, but they're currently not on treatment, they previously had treatment, and either on follow-up or having beaten cancer, they don't need to do anything different from what has been standard recommendation by the Department of Health or your district hospitals. Essentially, the same precautions of what a non-cancer patient takes has to be taken by them, such as isolation, hand hygiene, and not coming in contact with people with history of travel to places that have been exposed to coronavirus. However, those patients who are currently on anti-cancer treatment, such as chemotherapy, targeted therapy, or immunotherapy, have to be extra careful with the exposure to coronavirus. Now, they have to take extra precautions because these patients are immunocompromised and the severity of the coronavirus may be higher than the normal population, and in lieu of that, the death rate can also be higher in those patients who have cancer and are exposed to coronavirus as opposed to those patients who don't have cancer.